Okay, let's do a quick discussion about cholesterol because a lot of people have been asking about it. First of all, cholesterol is a marker for disease. It is not the sole cause of heart disease, but it is an important marker. So there was a recent study done in the Cooper Clinic where they followed, I think, 30,000 people for 10 years. And the interesting thing is they followed people that had elevated cholesterol, elevated LDL cholesterol, but all of their other markers were okay. So they weren't diabetic, they didn't have any other indicators. And in fact, when my doctor saw that my LDL cholesterol was high many years ago, but everything else was fine, he said, "Nah, don't worry about it, you'll be fine." It turns out from that Cooper study, that's not the case. Elevated LDL cholesterol was an independent risk factor for mortality in that study, and it was pretty dramatic. And there's been many studies like that, but I thought the Cooper study was a really excellent study, so you could look that up. So LDL cholesterol does matter. Why do people say that cholesterol doesn't matter? Well, there's been several bad studies. There's univariate analysis where they say people dying of heart attacks in the hospitals don't always have high cholesterol, and that's true because a lot of them have been sick for many years. They may have had high cholesterol for many years, and then they're in a hospital for several months, and during that time their cholesterol levels drop and then they die, and they say, "Oh, look, he had heart disease but not high cholesterol." Well, that doesn't work. There's also some really bad cholesterol studies that have been done where you got to understand something about cholesterol absorption. So when you look at cholesterol absorption, you'll find something like this on a graph, and that is that if you're eating low levels of cholesterol, as you increase cholesterol that you eat, you do increase the cholesterol in your blood. But you get up to someone who's eaten, tons of eggs and tons of saturated fat, they actually have a downregulation of their cholesterol absorption. So if we did a study on someone up here and then we gave them a little bit more cholesterol and their cholesterol didn't go up, we might say, well, cholesterol doesn't affect your blood cholesterol, but it does, especially if you're vegan or you eat low saturated fat and low cholesterol levels. So if you're vegan and all of a sudden you say, "Oh, I'm going to have a few eggs in my diet," you may see a pretty dramatic rise in cholesterol, whereas someone over here eating a bunch of eggs a week adds an egg or two, he's not going to see a big difference in cholesterol levels. So it's important to understand cholesterol absorption does change over time. Most of the cholesterol that we have in our body is actually generated by our body, which is how the statins work. They stop your body from generating cholesterol, whereas just a small percentage of it is actually absorbed cholesterol. Now, saturated fat's a whole different story. You eat more saturated fat, you get a higher cholesterol. There's no question about it. In a recent ketosis study, randomized controlled trial, because the ketosis people are always like, "Oh, you vegans don't do randomized controlled trials," which is not true. We do. In fact, we have the only randomized controlled trial that actually shows a reversal of heart disease. And this randomized controlled trial of ketosis showed, in fact, there was a 40% increase in LDL cholesterol levels, which is dramatic. And if you look at that Cooper study, dangerous. So you want to get your cholesterol under control. Now, I started my whole process with healthy eating because I had high cholesterol and I didn't want to go on a statin medication. And I also had hypertension and I was not healthy. And as I studied diet and found out all the stuff I did not know before, I'd never studied the EPIC database. I'd never studied the Adventist Health. I didn't know anything about Ornish and his randomized controlled trials or Esselstyn and all these different studies. And as I learned all of this, I was like, "Oh my gosh, this is huge." And I went on a very healthy diet. And as I went on a healthy diet, in fact, my biggest change was from vegetarian to vegan, where my cholesterol levels really plummeted. And my cholesterol got down to a completely normal level. Then, of course, moving to Asheville, I became a veggie burger and beer guy, which was not healthy for me. I didn't feel good. My cholesterol level went up. And the cholesterol level probably goes up because in those veggie burgers, they could have been hiding egg in there that I did not know about. It's grilled on a grill that may have had saturated fat on it. You get a lot of palm oils and vegan junk food that has saturated fat with it. I was loving my coconut ice cream, but coconut does have stearic have different kinds of saturated fats. And typically, it has a type of saturated fat that does not increase cholesterol as much, but in certain prone people, it will. And that is me. Now I'm back on a very healthy diet. For people that really struggle with cholesterol, the Portfolio Diet by Dr. David Jenkins is very interesting. It is evidence-based, a very good way to lose cholesterol. And it's based on fiber, because if you eat a very high fiber diet, it binds your bile acids. And if you're binding your bile acids and taking it out of your body has to use cholesterol to create more bile acids, and so that will lower your body's cholesterol. It'll put it to use. It also fosters good bacteria, obviously, and we know that having good bacteria and a good microbiome is anti-inflammatory and protective. Of course, a plant-based diet is excellent for your blood vessels, so while your cholesterol could be up a little bit, if you're also decreasing your inflammation and you're getting better plasticity of your blood vessels, has been shown in randomized controlled trials that if you have animal protein, animal fat, you will get blood vessel constriction that won't relax properly, but of course it does with a plant-based diet. And those things are going to be protective. But the other parts of that diet, of Jenkins' diet, that's important is plant sterols. Now, I can't believe the nonsense about soy being bad for you and soy being bad for your men are going to get breasts. I mean, I would be in a bra right now if soy was going to cause gynecomastia, because I do a lot of soy, and soy is very good for lowering cholesterol. It's a complete amino acid source, and it has been shown to help with actually preventing cancer. So there's a lot of misinformation out there. A lot of that misinformation is put out by the milk industry. It concerns me because I went to the store the other day to get some soy milk, and you almost can't find it anymore. All that's out there are the different milks. Everything's like, we don't have soy in our product. We don't have soy. Why don't you have soy in your product? That's what I want. I am using a plant sterol-based margarine on whole wheat bread. That is part of Dr. Jenkins' suggestions. And then I've also added amla. Amla is a powdered gooseberry, Indian gooseberry, and there's been some pretty good studies with amla helping reduce cholesterol. But by and large, those are little things. The vast majority of what's going to get your cholesterol down is a high fiber, low saturated fat diet, which is exactly what I'm doing right now. And I feel just incredible. I've been working out really hard and feeling really good and putting on muscle, and I owe this all to a very healthy diet. So I hope that helped clear things up. Thanks.